You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. Today, we're talking about dental implants. With us, we have a board-certified oral surgeon, Dr. John Lytle. Dr. Lytle, welcome to the program.
Nice to be here, Randy.
Now, for people that don't know you, tell me a little bit about your practice. Who's your typical patient? And what are the different procedures that you do as an oral surgeon?
I practice in the Pasadena, Glendale area. And my typical patient is a middle-aged person who comes in with concerns about their appearance, about their mouth, their teeth. They're wanting something different, a better smile, better look. That's the average patient who comes in to see me.
And you believe no more dentures?
Absolutely. Dentures
like
are...
traditional dentures?
Traditional dentures are 1900s technology, and we just don't think that that's appropriate for people. They fall out, they have all sorts of problems, people have difficulty speaking. It's old technology.
Okay, good. Now you work with, and I've had him on the show before, prosthodontist, Dr. Scott Addition. So you have kind of a team approach.
Yes, we do.
Tell me about that. How does that work?
Well, the patient gets the best of both worlds. The patient gets a prosthodontist who's well-trained and versed in implants and in restorative techniques. And then they get a surgeon who's had additional training beyond the typical dentist, I think, these days, who is placing an implant after very little training.
Okay, good. You know, I asked you about your frustrations. We're going to talk about what you can do for denture wearers in a moment. But I said, what frustrates you in the world of dental implants? Because it's becoming very popular.
The biggest frustration is that we're seeing many, many people having the implants placed by people that are ill-trained.
Okay.
And we can place an implant probably for less money, better, and give a better outcome.
Okay, good. People need to know, because I've been trying to get you on the show for quite some time, that great credentials. I guess past president of the Oral Surgery Association here in California.
That's correct. Cal
and I guess on the national board, you have involvement there too, right? When they want to become
an examiner for the American Board of Oral Surgery.
What do you do there as an examiner?
We examine oral surgeons, young oral surgeons who are becoming board certified from all over the country, and make sure that they're qualified to call themselves board certified.
Okay, good. So what are the categories of dental implant patients that you see?
Well, the most common implant patient that we see is a patient that comes in and has one tooth that's a problem. Okay. But beyond that, we see people that need 2 or 3 implants, and then sometimes even a whole arch of implants. Many people are wanting the results immediately, and we're trying to get that to them.
So when I hear you can walk in with no teeth and walk out with a set of teeth?
We're able to do that.
That's true?
We're able to do that in many situations. Not all, but many.
Okay. And if it's, and by the way, how big of a problem? I mean, how many people have dentures, are wearing false teeth or dentures, like in the LA County?
It's probably millions. It's a very common thing. Still, with that old technology, we're so surprised that people are still wearing dentures.
But if it's so good, where you're saying with as little as even, I guess 4 implants, get a full arch of teeth. If it's so good, why aren't they all doing it?
Well, there's perceptions of pain, of difficulty dealing with the whole process. They think they're too old. And the cost, they think, is just going to be out of this world. It isn't under most circumstances. Another reason, Randy, is that they just don't want to go to the dentist because they're dealing with so many problems. They've dealt with so many problems, and they just don't like going to the dentist.
Yeah, so I guess if you're wearing a denture, you're not going anymore.
You're not going at all. You're not going at all. You just wear the denture and you deal with the issue.
Now, what about if you're in your late, even though 75, 79, 80 is young today, still a candidate?
I have patients that we're doing these procedures on in their 90s routinely. So age is not an issue.
Why would a 90-year-old want to do it?
The same reasons that anybody else would want to do it. Better smile, better function. Their life is immeasurably better with fixed teeth in their mouth.
So do you teach other people?
We sure do.
I mean, you lecture to other dentists about dental implants?
I'm a professor at the University of Southern California.
Okay, and what is your topic over there? What are you teaching?
Actually, I teach people about anesthesia and medicine, but we're also heavily involved with implant surgery.
Okay, so you're a medical doctor. You became a medical doctor first.
That's right.
And then a DDS.
That's right.
How'd you get involved in dentistry?
My father was an oral surgeon, and I became interested in it as I was going through my traditional medical training. I was a physician first. And then I decided, well, let me take a better look at this. And as I delved into it more and more, I thought this was going to be a good fit for me. And in fact, it was. I went back to dental school, did oral surgery training, and here I am.
Interesting, good. I think it's a good point. We're talking about no more dentures, that it doesn't cost more to go to an oral surgeon.
That's correct.
In fact, most of the time, and you said it, it could even be less.
Well, we've done the procedure so many times that we know where to economize. We know what to do to make it better, but at a lower cost.
But pain, it does seem painful.
Well, we're able to
gotta hurt.
We're able to get people through this pain-free. The majority of my patients go to sleep. They're asleep for these procedures, either in my office or in the hospital or in a surgery center.
What about the next day?
Well, Randy, I have many, many patients that the next day they don't even use the pain medications. We've done a major procedure where we remove all of their teeth. We're placing 4 or 5 implants. The dentures are placed in, and they do not take the pain medicine.
So you brought some photos. What are we looking at?
I have a number of all-on-4 patients here, and these are patients that we place 4 or 5 implants, and the next day or the same day, we get them a full set of teeth that are screwed in and they can use.
Okay.
This is Donna.
All right.
Donna's a lady that came to me, and she had all sorts of problems. Couldn't eat. She had abscesses in her mouth, a lot of pain, mobility of the teeth, and she really needed an answer right away.
Okay.
So the teeth were removed, implants were placed, and a denture was screwed into the implants the same day.
Did they ever say when it's all done, I should have done this years ago?
Of course, all the time. This lady was ecstatic with the result. You can see how excited she is. She's happy about her smile.
Yeah.
She enjoys smiling. Look at her eyes. To compare the eyes in the 2 patients. This is a happy person, and she's excited about the change.
And they look real, by the way. And I'm not trying to side with you. People need to know it's a real interview. I'm not endorsing you. I'm asking the questions here. But I always feel like I could spot a denture walking down the street or talking to them. This looks very real.
These do look real, and these are the kinds of things that people like Scott Addition can make look very real and very permanent.
I mean, they could bite into what?
Anything.
Like an apple?
An apple.
Broccoli?
A broccoli, yes, absolutely.
Did they ever give you eating stories?
Absolutely. They talk about what they can get their teeth into right after surgery.
Is that right?
Yes,
interesting, interesting. So you're saying even if you're 90 years old, they're not more likely to fall out?
They're not. The bone is still there. The
Okay.
bone is holding the implants in.
Interesting, interesting. Okay, what else do you have?
This young lady came to me, and she had a complaint of her lower teeth being painful. She didn't like her smile. She didn't like the way the lower teeth looked. She'd already had implants on the top. And so we were able to investigate and decided that she also would be a good candidate for implants on the bottom and immediate placement of a complete set of teeth. So Randy, here's her follow-up photograph, and you can see the character of her smile has changed. The lower teeth, which is what we worked on, are very different, and her smile, because of all this, changed. You can see it in her eyes, you can see it in her mouth and her lips.
Are there more women coming in to do this? Or is it a mix, men and women?
I would say there are more women, but we do men also.
Men put it off?
Men put it off.
They wait?
They let their wives do it.
Are there a lot of people that are out there that are watching this that haven't been in the dentist 10, 15 years? Maybe they've been told their teeth have to go. What do you say to them?
We have the answers for you. Come on in. We can do the work. I think people are afraid, or they're worried about the pain, they're worried about the dollar amounts, and they don't know really what to expect. Come in, and I think you'll be surprised at how easy this process is.
So 4 dental implants on the lower, and they get a full arch of teeth.
That's correct.
And they don't snap in and out. I mean, these are
screwed in. In this patient's case, we did 6, and we're able to screw the denture in, the complete arch of teeth, the same day.
And they just go in, what, for checkups?
We do checkups every few months initially, and then usually yearly after that. And most of the checkups will be done with the prosthodontist who does the set of teeth.
Okay, so it's a team approach. So the oral surgeon, you do the surgical part?
That's correct.
And then like Scott Addition, in this case, Dr. Scott Addition, who we're going to have up next,
and then
creates the natural smile.
And he places the teeth, creates the smile.
On top of it. Okay, we have time for a couple more. What else do you have?
Cynthia came in to see me.
All right.
And she had a complaint of upper teeth problems for years and years. And if you look at the close-up of her teeth, things don't look too bad, but there's all sorts of issues that she'd been dealing with for many years, and she was very unhappy and had a lot of pain.
Okay.
And she knew she had options. She could have done a full denture. She could have done maybe an implant or 2 with a little attachment. And she knew also that there was the best option of 4 to 5 implants with a screw-in complete arch of teeth.
A fixed set of teeth.
A fixed set of teeth.
Okay.
And that's what she chose.
All right, let's take a look here. Very nice. I mean, it's a good-looking smile as well.
Absolutely. And it changed, I think it's changed her personality. When she comes in, she's an upbeat, happy person, and the issues in her mouth have definitely changed.
So they can eat, they can chew.
She can basically do anything.
Now, you also do with dental implants, I want to get this correct, that you do like a snap-in, snap-out option.
Those are an option.
But you like fixed.
We like fixed. It's
That's
more
what
like
people
your
want.
natural teeth. That's what people want. They want natural teeth. They want teeth that do everything and they don't have to worry about it.
So no more dentures.
Dentures are old technology.
Now for the upper, by the way, the big benefit, you say the roof of the mouth is no longer covered.
Absolutely.
Like
with the denture, you have plastic. With this, there's no coverage. You taste your food better. You talk better. The whole experience is different for the patient.
Okay, so final message, and I want to thank you for coming on the show.
Thank you.
A denture wearer that's watching this, 70s, 80s, whatever, they're afraid of pain, all the, what do you say to them?
Come in and get an evaluation. We can review all of these details for you. I think you'll be very surprised at how easy and simple this process is.
So the consultation doesn't cost any money?
No, we have free consultation.
So they can meet with you?
Yes.
You just give them a treatment plan?
Treatment plan, we get an x-ray, we evaluate the whole scenario, and then we move from there.
All right. Now, in all areas of dentistry, are the dental implant patients the happiest, the people that you give a fixed set of teeth?
Absolutely. They're transformed. They're transformed.
Well, thank you for coming to the show. Very good. Very interesting.
Thank you, Randy.
And if they want to find out more, now you have a few offices.
We have 3 offices, Pasadena, Glendale, and La Cañada.
All right. And you will meet with the patients on the consults?
I will meet with them personally.
All right. Thanks again for coming on the show.
Thank you.
You've been watching the Wellness Hour. I'm Randy Alvarez. Up next, the other part of the team, Dr. Scott Edition. No more dentures. You gotta stick around for this next part. We'll be right back.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.